Hi, my name is Dr. Kristie Johnson. I'm a primary care physician at Tamarack Health. I grew up in an unincorporated area called Chaffee, Wisconsin, which isn't really a town anymore. There's like a bar and a baseball field, and the bar closed recently. My grandma was from the Washburn-Bayfield area, so we had some ties to the area, but I came back here after I finished my residency. We met in elementary school, so my husband is from the same area that I'm from, and we went to college together. We got married very shortly after we graduated college, and we moved to New York City for a couple of years, and he worked with the street homeless in New York, and I worked in the community health center. I learned more about primary care, and it kind of rekindled my interest, and then I had a lot of encouragement there. We ended up moving back, and he did his social work degree. In the program at UMD Medical School, they set you up with a family doctor to be a mentor in a small town, to just make sure you have that exposure and to let students know what it's like to practice in a small town. And I was placed in Ashland with a family doctor who worked here, and one morning that doctor said, we're going into the hospital today. We have a patient who's gonna have a C-section. And I thought, oh great, I've never seen a C-section before, and I was gonna get to scrub in. And it was at this hospital when it was called MMC. And we get there, and I did not know until that doctor started the C-section that he was performing it. And that was when I learned that family doctors could do C-sections, and I was hooked. I remember it to this day. I was so excited. And then after, I kept waiting for the surgeon to come in, and I realized that this mentor family doctor was the surgeon. And I don't know, it was just caught me at the right moment, and I thought this could be my life. It felt so great and so perfect. It's helpful when you do prenatal care with someone and you've gotten to know them throughout their whole pregnancy, then when you can kind of explain the situation of what is it like to be in the hospital, and why do we have access to all of these things in the hospital, and what could potentially go wrong. And of course you hope nothing will, but I think when people want to have a non-medicated birth and they don't want to be using pain medicine, or they don't want to be induced, we kind of just talk about, okay, where is that coming from? I'm not going to force pain medicine on anyone, but I also want people to know that if they need to have pain medicine, thank God we live in 2026 and it's available and it's safe. We enjoy camping a lot. We go camp in the summer. We like to go swimming on the small lakes. My husband and I love to go to rock concerts. We just love going to outdoor music. Big Top Chautauqua is wonderful. I think it's wonderful that we have it so close. So we do that. We go to a lot of concerts up in Duluth and the Twin Cities when we have the opportunity to. And I've made several friendships from people that also like to run and that I can run with. And so that's just a fun thing. I love that about Ashland too. It's a very active town. People love to run, they love to ski, they're so busy. You don't have to look far to find a running community, which is really fun.